So now we look at a specific reform which was done to improve the health indicators related to rural health or maternal or infant health. So the basic level of primary health service in Pakistan is provided by the BHUs, which is Basic Health Unit. So it provides the essential preventive and curative care. It serves around 10 to 15,000 of people. In every union council, there is supposed to be a BHU, and which looks at around 5 or 6 kilometers of radius. This is how the Provincial Health Department or Provincial Health Services is structured. So at the lowest level is the Basic Health Unit, BHU, then above that is the Rural Health Centers, then above that is the Tehsil Headquarter Hospital, then above that is the District Headquarters Hospital, and then there is the Tertiary Care or Tertiary Hospitals. So at the BHU level, we have, if you look at the staff of BHU, there is a doctor, there is a female trained birth attendant, vaccinators, and paramedic staff. Rural health centers, which is one step above the BHUs, represent the next level of healthcare, and they have some beds to have inpatient care also. So BHU doesn't have any facility for taking care of patients for a longer time. So RHCs, if there's a patient has a problem at BHU, they are going to send it to RHC or the Tehsil Headquarter Hospital. So there are some 5,500 BHUs in the country and 550 RHCs in 2012. So the idea was that how to utilize these BHUs and RHCs better. So most of the people are not really using these BHUs and RHCs. So government tried different reforms. So one of the so these were like construction of residences so that doctors and female staff can stay in close to BHU. Otherwise, most of the people who are living in urban area, they are not ready to go to rural areas to serve in the BHUs and RHCs. There was also a special allowance given to those doctors who work in the rural areas. There was also management information system, so to monitor the presence of doctors and staff. There were also budget increases to the BHUs, but there was not much change. So a new reform was that the BHUs and RHCs were transferred, their management was transferred to NGOs. So, if we look at there were 5 national surveys between 2001 and 2012, and these surveys will look at how the reform of contracting out BHUs to the NGO worked. Was it beneficial or was it not beneficial? So, if you look at the results of the 5 surveys, there was no large gains of the contracting out policy. So this reform didn't really resulted in outstanding success. There were some small studies which argued that it was a big success, but large national surveys said that it didn't. The primary health care remained heavily underused, so even after these contracting out, BHUs were not used. They remained underused, and the only change was that the childhood diarrhea, in case of childhood diarrhea, more people started using BHU instead of self-medication or private medical help. So why this reform failed, this contracting out? There were modest additional budget to the BHUs. There was limited management authority of the agency, so the staff was still, employee of the government. So the punishment that the contracting NGO could give was very small. And then there was lack of clear performance indicators. So these were the reasons why this reform failed to generate much result. Thank you.